All right, everybody, welcome. I'm Dr. Rob Mabry. I'm the founder and creator of ESAP, Easy Skeletal Alignment Program. And if you're here watching this video, chances are you've already purchased the program. And so the pelvic leveler, the device, is the central component to that program. If you had to choose between doing all of these stretches and anything else, I would choose using the pelvic leveler. It helps to balance the connective tissue IQ on the left to what we've been training the right side to do ever since we started driving, okay? Some of this work is based on, in my mind, on the work of Tom Myers. He's a soft tissue guru out of Maine, and he's an internationally renowned teacher and seminar presenter based on his findings and his theories on how everything's connected. He's proven that in the laboratory with cadaver work, etc. But he talks about, he calls it tensegrity, how everything is interconnected and how the whole body works together. And that's where I came up with the concept of connective tissue IQ rather than just musculoskeletal. It's a pretty dynamic concept. He talks about anterior lines, or these front lines, and then posterior lines, the lines on the back, all the way down through the hamstring groove into the foot. And then he talks about a spiral line that works when we're doing different types of activity. But for our purposes here with the ESAP program, what we're going to be doing is, and I'm going to be showing you, is very specific stretches to balance the front lines, to balance the back lines. And when I say balance, I mean from the left side of the body to the right side of the body. It was my experience in chiropractic care that the overwhelming majority of patients that I evaluated had some very common presentation. That dysfunctional biomechanical pattern that I spoke about in the podcast series. They had left SI joint fixation. The right pelvis was rotated forward. The left side of the pelvis was rotated back. The right leg was short. The left leg was long. The paraspinal muscles, these big muscles on the back, the left side was tighter than the right. That's a dysfunctional pattern based on your gait that we get from the effects of driving the car and raising the IQ on the right. So the great benefit of the pelvic leveler, the device, is that you're training the left side to do what the right side's been doing ever since you started driving, and you're raising the IQ, which is going to positively affect your gait, which is going to balance a lot of that connective tissue. Okay, the first thing we're going to do, the first one I'm going to show you, is balancing the front lines. And how do we do that? We mainly want to work with the hip flexors and the psoas. The psoas muscle is a hip trunk flexor. It kind of does this. It attaches from the upper part of your thigh bone, your femur, goes through your pelvis and attaches directly to your spine. If I get a tight psoas or tight hip flexor group, I'm pulling that side of my pelvis forward. That's where we get the unleveling, the rotation, and the short leg. The effects, if you've been to the website, then you've probably seen the video that Dr. Masood did. He was gracious enough to allow me permission to use that, and he illustrates perfectly the global effect of pelvic rotation and unleveling. And so that's what we're trying to undo here, that wind up, as I call it. So how do we balance, or how do we stretch the psoas? The easiest way for me that I have found is you can do this on a weight bench at the gym. You can do it on a couch at home, on the side of your bed. A firmer surface is a little bit better for these stretches because a lot of with too much cushion, it becomes harder to keep yourself square and balanced. So what I'm going to do is I'm going to lunge if I'm going to stretch my right side first, I'm going to lunge my left leg forward, bent knee. I'm going to keep my shoulders square to my hips. Square. I'm not going to be bent like this. I'm square, shoulders to hips. I'm going to put my left knee on the bench or the sofa or the couch, the couch or the bed, and I'm going to drop my pelvis straight down. I'm going to drop my pelvis straight down. It's very subtle. You have to take some time to relax. The tendency is to contract your glutes and get tight in your lower back, but you want to relax all that, and you want to feel your right hip flexors just letting go. And then I would do the same thing on the left. And you want to monitor how that feels, the right side compared to the left, and you want to spend a little bit more time working the tighter side, which for the vast majority of you is going to be the right hip flexors. They're going to be tighter than the left, okay? So I'm going to keep my hips and my shoulders square. I'm going to put my left knee on the sofa or the bed, and I'm going to drop my pelvis straight down. And I'm going to relax my hip flexors. It's almost a mindful exercise because the tendency is for everything to be tight. And you want to really feel like your pubic bone and your belly button are dropping straight to the floor. Yeah, it's a great little stretch. And you want to, the ultimate goal is to balance the hip flexors on the right to the left. And I could tell that my right hip flexors were a little bit tighter than my left. So I would do this for a count of 15 or 20 seconds. I would relax. I would go around and do the other side, 15 or 20 seconds, and repeat. And I would spend an extra rep or two on the tighter side. And I would do that on none of this work, the pelvic leveler or any of these stretches that I mentioned are a get well quick strategy. This is going to take consistency over time. You can't go into the gym and get fit in one visit. It takes consistency and frequency. And all of these stretches that I mentioned and using the pelvic leveler is exactly the same.